Hello and welcome to Utopia, the future of mental health solutions. We should start by defining mental health, which can be described as the emotional, psychological, and social well being of a person. Mental illness can begin at any age in any person, and they have certain needs such as assistance from specialists and effective treatments for their disorders in a safe environment. The problem with providing mentally ill patients with these resources is inaccessibility, ignorance, inefficient practices, and limited option. The goal of Utopia is to abolish these problems and allow for a streamlined practice in mental health. There are many benefits to introducing modern solutions such as applications in the realm of psychology. For example, our annual package is calculated to be lower than a few live sessions with a therapist. Accessibility is also important as it allows for incapable people to receive proper mental health treatment from our application. Our main drawback is the youth of the idea. As this idea is still in its early stages, we do not have technical research to support our claims. The state of modern and traditional approaches to mental health treatment is less than ideal. As mental health apps do not provide assistance as promised, suicide has become an epidemic with one person dying from suicide every 40 seconds. The issue is also financial, as productivity rates decrease. The global economy loses $1 trillion per year due to decreased productivity from depression and anxiety. This problem also hits home, where 5.1% of our society struggles with depression. This is the highest in the region, and less than half of the 139 countries have mental health policies and plans report having these aligned with human rights conventions. The existing solutions for online therapy and assistance is expanding with new applications coming out every day. The leading apps on the current market are MoodPath, which is a depression regulation tool which screens your well-being based on regular in-app questions, following the criteria for diagnosis. However, this is AI-based, which can lead to an inaccurate diagnosis. Calm, which is a sleep therapy app, uses meditation and sleep stories to treat insomnia and anxiety. The drawback to this is a lack of research making it an invalid solution. Headspace offers tools to treat anxiety, but similar to Calm, it is not research-based and may assist mild anxiety, which is not optimal for the general population. These apps fall under the mental health app category but are not viable options for individuals struggling with their mental health condition, unless they are used with conjunction with therapy. The methodology for Utopia was as follows. Secondary data was collected from online scholarly articles and previous relevant studies. From there, experimental design with 2 web-based surveys was conducted, and from that, a high-fidelity prototype was developed. We also conducted a random sampling of 260 respondents and cross-sectional surveys for further research. In the survey we conducted for our research, the demographics breakdown is as follows. With a total of 250 participants living in the UAE, 55% were female, 44.5% were male, and 0.5% prefer not to mention the gender. 68.8% of participants were between 18 and 24 years old. 7.5% were between 25 and 34 years old. The remaining were over 34 years old.
In this section of the survey, we found that only 12.9% of the respondents were knowledgeable about mental health related issues, while 47.5% were familiar and 33.8% had a neutral outlook towards mental health issues, while 4.6% of the participants had no knowledge at all. We next decided to identify if a mental health condition has been declared in their place of study or work, and 63.2% of the participants have said no. They do not share or hear others talking about their mental health conditions in their place of study or work. When we asked them why they didn't want to reveal about their mental health, majority of the participants said that they didn't want to be treated differently. This clearly shows that there is stigma surrounding mental health conditions and that the participants fear being labeled as lazy and attention-seeking if they ask for help. We also wanted to analyze the impact of COVID-19 on one's mental health, and majority of the participants have agreed that they have often felt sad or depressed, which has interfered with their personal relationships and the ability to get work done. Furthermore, we wanted to know the preferred treatment method, and 58% of the participants preferred an app due to its anonymity and privacy. Living in a technological era has many benefits, one of which is improved understanding of health, especially mental well-being. Nevertheless, growing recognition has not entirely eradicated the taboos associated with mental illness and the need for medical treatment. and that's where the advent of mobile mental health devices is starting to improve the situation. We conducted another set of web based surveys to analyze the features that should be applied to our service. We also showed them a prototype to understand how they react to our service. Based on the conducted interviews and surveys, very diverse results were derived when asking users for their preferences. This shows that every patient has a preferred method of self care, and an equal amount of attention to each and every feature should be adapted to provide for our users to ensure they get the help they need. Overall, all the interviewees liked our idea of medical mental health care on a digital platform, and our services can play a vital role in achieving the objectives of the National Policy for the Promotion of Mental Health. Our service is a conceptual mobile application that combines all the features a patient could ever need to care for their well being. Other applications may aid with specific disorders, but our services can help patients with more mild cases as well as patients who require deeper therapy. This application will be a one stop mental health facility which can be accessed online through any smart device. Our aim is to provide a robust platform in which people can learn to control and conquer their mental illnesses in a variety of ways. Our service is also unique because we offer personalized treatment based on individual needs along with the general mindfulness and wellness that most other apps offer. Digital health applications will also help bridge the void by mobilizing mental wellness. Apps will also act as a digital lifeline, especially in rural and low income regions. The customer will likely pay for the solution due to the convenience and abundance of content it offers and the general effectiveness to provide credibility to 24/7 availability and support via a virtually deliverable medium that boasts exclusive licensed professionals, medically trained staff, life coaches, and curated partnered content. The solution effectively is an investment for a happier state of mind. Our primary target market is anyone between ages 16 to 45, like students and working professionals, and people with common mental illnesses. Our service can also be used by retired individuals. We provide a range of features like e-therapy, life coaching, an online community, and general wellness and mindfulness, along with an abundance of more positive content and features. Our main focus is identification, prevention, cure, and most importantly, privacy. We aim to develop even more features as time progresses to provide a solution, fill the gap where mental wellness apps currently fall short, and also provide solutions to help our customers feel at home by partnering them with professionals from the same background, language, and culture. All these functions have been built to help people understand what they fear emotionally and also to inform the society as a whole about the value of mental health and its associated problems. In view of the worldwide scarcity of therapists and the lack of access to mental health services in underdeveloped and developing countries, our service is a viable tool to bridge the gap in mental health treatment and put a portable therapist in everyone's pocket around the world. For our feature improvements, smartwatches like Fitbit and Apple have stress level features, and another tool is a galvanic skin response in which measurements work by detecting changes in electrical activity resulting from changes in the sweat gland. In our service, this GSR feature will be implemented using the wearable technologies, and the data collected based on these changes in sweat gland activity will be sent to our application to determine the stress levels of the user. This system will be used to help the user feel relaxed, such as changing the ambience like turning down the lights or playing soothing music. And based on further research, this feature will be implemented. Another feature that will be researched on is the virtual reality. This has been found to reduce symptoms when used as a treatment for anxiety disorders, substance abuse, and PTSD. A main benefit in VR is that individuals realize that a computer world is not actual, but their brains and bodies respond as though it is real. Thus, people can encounter challenging problems in VR even more quickly than they do in real life. and will be able to test out new therapeutic techniques. This feature will be implemented along with the e-consultation, e-webinars, and physical therapy features for the users based on doctors' advice.